Good morning, ladies. Let's learn the truth about menopause. So today we're going to talk about menopausal therapy, lessons on hormone replacement therapy or hormone optimization therapy. Hey guys and ladies, it's Dr. Eric, the fitness physician, where I talk about all things related to muscle medicine, muscle cellular medicine, hormonal fitness, and much, much more. So a lot of myths out there about hormonal therapy. So I'm going to just go give some quick summaries today on some trials and studies that have been done and science backing this up, the things that we talk about. So bottom line is there's multiple studies on this and showing the benefits of certain therapies for hormones in women in menopause. So the bottom line is with bioidentical hormone optimization therapy, there's across the board about a 30 to 40% drop in cardiovascular disease risk or coronary heart disease. That's huge. Nothing else can do that. No synthetic drugs out there, no quick fixes, right? This is a huge drop. And of course, cardiovascular disease is the #1 killer of men and women. And this is a massive change, right? The DOP study, this is a big 10-year study. And what they found is that there is a decrease in mortality, MI, heart attack, and coronary heart disease, as well as congestive heart failure. That's huge. Those are all the big movers, right? Death, heart attack, and heart failure, right? And this is a big, long study with DOPS. The ELITE trial was also a similar study that showed a decrease in cardiovascular disease progression, improvement in cardiovascular outcomes, similar to the DOPS trial. And both these, especially the ELITE, was oral 17-beta estradiol. This is the myth that I talk about with people on the forum. People are still talking about oral estrogen is bad. It's not good. No, and I'll talk about this later, but oral bioidentical 17-beta estradiol is what you make in your bodies every day. We all make it. And that's what causes the good outcomes. This is why you don't want to block estrogen. And ladies, this is why you want to take oral estradiol, not the creams, not the Prempro, not the patches. They're okay, but they don't give you the same benefit. All these studies have shown oral 17-beta estradiol is the only one that has the dramatic increase in cardiovascular health, improvement in your bone structure, prevention of osteoporosis, prevention of breast cancer, improvement of your cholesterol, your lipids, your HDLs, your LDLs, all these markers. The creams just don't do it. They do a little bit, very much less, and they do not cause liver issues. There's everybody worried about, it's going to get metabolized in your liver. It doesn't happen. It doesn't cause increase in triglycerides. It doesn't cause liver fat problems. It doesn't cause blood clots. We'll talk about that more later. The nurses study was a huge study. There was a 40% drop in cardiovascular disease. And again, all these studies said there's no increase in DVT, which is a blood clot, or cancer. So the biggest thing, and I can't, there's not enough time in this video to talk about it, is that this is 17-beta estradiol versus Prempro. This is the back in the day when they were studying Prempro and Prem, which women were going for decades and had improvement in health. But the people that talk about with like liver issues or blood clots, these were with synthetic birth control pills with synthetic estrogens, and Prempro and Premarin. These are synthetic. They had chemically made estrogens in them that were way more powerful than 17-beta estradiol. They also had estrogen derived from horse urine, right? In addition, this is 17-beta estradiol. So that's the difference with 17-beta estradiol. It's bioidentical, it's not synthetic. It's what your body makes your whole life. And that's why the difference is. So when people hear about all these things, this is for years, this is what was coming from. They're confusing estrogen with estradiol, or Premarin and Prempro with estrogen. So estrogen and estradiol are not the same thing. And that's where the confusion lies. And so a lot of people just can't get it in their head. They're still talking about estrone and estrogens and all these things. And the same thing, the other part was that a lot of these studies used micronized bioidentical progesterone versus MPA, which is basically synthetic progesterone, which is progesterones or progestogens, which you'll see in birth control, synthetic birth control pills, or you'll get from the doctor when you go to CVS or something like that. You'll get the synthetic form. Same thing. The synthetic version was what was causing the problems. When you use a synthetic progesterone, progestogen versus oral, or basically a bioidentical progesterone, there's a huge difference. Oral bioidentical progesterone actually helps 17-beta estradiol improve all these things. It drops your risk of cancer, drops your risk of clots, drops your risk of strokes, and improves your risk of living longer, of having better health, decreased risk of breast cancer, decreased risk of osteoporosis. Where you did the synthetic forms, that's when all the problems happen. And again, this is like a 4-hour discussion to get into this, but that's the bottom line. This is what this study shows. This is what it shows clinically. This is what I've seen in my thousands of patients with all my colleagues and mentors like Dr. Neil Ruse and all my colleagues who've been doing this for decades. So these people that everyone out there is saying, oh, you know, progesterone is bad, estrogen is bad. It's not. Again, there's a difference. Everybody thinks they're the same, but they're not. So ladies, that's why I do what I do. And that's why all of us in my group do what we do. And we have these kind of outcomes. So if you want to live longer, stronger, better, reduce your risk of all the things that are going to kill you, And this is what you want to do. Join the Primex tribe and learn how you can do this. So if you're interested in working with me or just want to have a quick chat, DM me below and I'm happy to jump on a quick call with you, okay? Please like and share this post. I'm doing telemedicine all across the country at drericprimex.com. A lot of cool new products. I've got a ton of ebooks and free giveaways, free things on my website, more things to come, and my own product line coming out as well, so stay tuned for that. And so if you want any tips or tricks or discounts on any program supplements or anything else, just reach out to me. Again, if you're interested in working with me, just if you want a quick discovery call, just DM me below. And again, please like and share this post. Everyone have an awesome day, and we will talk to you all soon.